So for early interventions, again, my approach and the general clinical parameters that we look at help in guiding parents in understanding the global scope of what may need to be done. Information is helpful for parents to properly prepare, and earlier intervention can also help in modifying behavior and allowing patients to get more comfortable in the dental and orthodontic office. For patients who are appropriately treated, we can have recommendations to the dental team, to the surgical team, by making early decisions and projecting to limit some of the more complicated work that needs to be done. For instance, if there are teeth that are severely crowded, if there are teeth that are located in the areas of the cleft gap, we can offer resources and decisions to minimize the complexity of the work that needs to be done in the future.